clock and stay within those 5 minutes. The FDA's emergency use authorization of the Pfizer vaccine for children 5 to 11 years old is really a big step in the pandemic response. It will make 28 million children eligible to receive a vaccine. And given the spread of variants, getting kids vaccinated is really critical to protecting them while also protecting our educators and our parents and other caregivers. Dr. Woodcock, I wanted to ask you, can you describe FDA's thorough review of scientific evidence in making this decision, as well as your advice to parents who are hesitant to get their children vaccinated?
Yes, certainly. The FDA first reviewed the manufacturing of a new dosage form because the children need a lower dose. That was very carefully reviewed, as well as the stability of the new dose to make sure that it was appropriate. Then all the data on the children were reviewed at the patient level. In other words, we went to the raw data and re-reviewed that and made sure that the evidence that was presented to us accurately reflected both the data on effectiveness, on efficacy, on the immune response, and on safety. And we looked at all the adverse events to make sure that they were properly reported and that we understood the magnitude of those events. So in this trial of where thousands of children received the vaccine, ages 5 to 11, we saw mostly very mild to moderate flu-like symptoms primarily after vaccine, or a sore arm, which people can expect after getting a shot. But we did not see any serious adverse events, and the vaccine was over 90% protective. So we feel very confident, along with all the adolescent data that we have on this vaccine and all the data in administration to adults, that this vaccine is safe and appropriate for children. It will protect them from severe COVID.
Thank you. Dr. Walensky, this morning OSHA released an emergency temporary standard to protect workers against COVID-19. This is a critical step to reducing workplace transmission and making workplaces safer nationwide, especially for our frontline workers who are at high risk of COVID-19. Can you just speak to us from a public health perspective about the urgent need to get more Americans vaccinated and the importance of implementing measures to protect people from infection in higher risk settings like our workplaces?
Yeah, thank you so much. We've had 745,000 deaths from this disease, and we're continuing to have about 75,000 cases every single day. We know the most disruptive thing in a workforce is to have a COVID outbreak and to have workers in that workforce come down with COVID infection, severe disease, and in some cases, death. Vaccination, as we have seen, decreases your risk of infection by 6-fold, decreases your risk of hospitalization and death by 10-fold, even during this Delta surge. So there is absolutely a public health priority to get people vaccinated and to continue the important prevention and mitigation strategies, including masking, to keep them safe. Thank you.
Thank you. This is a question for the whole panel, and I don't have much time left, but I would use my chair prerogative to ask all of you because it's an issue we are all concerned about. Senator Burr mentioned it, and that is the issue of testing. We know diagnostic testing is critical. But we've continued to experience critical challenges with testing, shortage of rapid tests, not enough locations to get tested, supply chain issues, and more. So I'd like to ask all of you quickly to respond. What is your agency doing to make sure our country is well equipped to handle current and future testing needs? And I will begin with Dr. Walensky.
Yes, thank you so much. So we are working with states and jurisdictions to make sure we can provide technical assistance on how best to utilize these tests. This is important in the school districts as well. $10 billion in school districts to utilize testing. We provide technical assistance as to how to utilize it and peer-to-peer, school-to-school advice on how best to utilize the testing program, as well as the hiring of school nurses in order to use the testing program.
Thank you. Dr. Woodcock?
We have streamlined recently our standards and approach for over-the-counter tests. So as I said in my testimony, so that we hope they should get out more quickly. We prioritize testing where there's a public health need, which right now is the over-the-counter tests. And we also try to move very quickly those manufacturers that can make large supply of tests, because there is still an unmet need there. And so we think between that, we have authorized 11 over-the-counter tests and expect more to come. Between that and what ASPR is doing, that the supply should increase rapidly.
Ms. O'Connell?
Thank you, Chair Murray. We've invested $3 billion in the last 2 months on increasing production and supply of rapid point-of-care and at-home tests. $1 billion of that focused exclusively on at-home tests. So we continue to try to get those out. We also, through HRSA, started a pilot program which would provide free at-home tests through their federally qualified health centers. So for those families that aren't able to afford the tests in the pharmacies, this would allow free access.
Dr. Fauci?
Yes, thank you, Madam Chair. The NIH is prioritizing the development of affordable at-home tests through a program called the Independent Test Assessment Program, or ITAP, which we will provide reliable, independent laboratory and clinical tests to the FDA for the manufacturers so that they can scale up quickly. And if the tests meet the FDA's performance and quality standards, the FDA hopefully will then give an emergency use authorization. So we're providing data for the companies to be able to expedite the availability of tests that are rapid, efficient, and point of care.
Thank you. Senator Burr.
Thank you.